We did our first one here about 2 weeks ago, and it was the first one done in Erie, Pennsylvania. So it is a very new procedure.
Can you tell us a little bit about what it is?
Sure. So the BEAR, the Bridge Enhanced ACL Repair, is using a specialized implant, which is a collagen-based implant. And what we do is...
It comes from a cow, right?
Correct. It's bovine derived. And what it does is it allows for the patient's own blood to be absorbed and concentrated in a single area. And that implant is placed at the site of the defect on the ACL. And the bridge enhancement effect is that it allows the cells that would normally try to repair a ligament tear, in your body. Those cells are in place to do that job for you. The problem currently is when you tear your ACL, the environment of the ACL within the knee joint is not conducive for healing on its own. So there is a fluid called synovial fluid, which is the normal lubricant of your knee joint. That fluid, although it's wonderful for what it's meant to do, it does not allow the reparative cells that would normally do their job elsewhere in your body to do their job in the knee. And so the ACL does not have the capacity to heal itself. The BEAR procedure, the Bridge Enhanced ACL Repair, in using this implant soaked with the patient's own blood, it allows for a concentrate of the blood to stay in the area where it needs to be to enhance healing of the ACL. The recovery between the traditional way and the newer method is about the same. The benefit is the decreased comorbidity. And what we mean by that is the patient is no longer required to donate, if you will, their own tissue for a reconstruction or receive donated tissue for their reconstruction. Tissue, we now have the ability. Every time you take tissue from elsewhere in the body, you're having to give something up. It's a sacrifice. You're sort of robbing Peter to pay Paul, if you will. And so if I have to take a quadriceps tendon, for example, a portion of your quadriceps tendon from your body, those make excellent ACL reconstructions. However, there's associated quadriceps weakness after. If I have to take your patella tendon, there's an associated risk of ongoing knee pain after. If I take your hamstrings, there's a decreased push-off strength after. So everything comes at a cost when we take tissue from the body and use it for a different purpose. But that's not the case with the BEAR. We're the only in Erie, Pennsylvania that's doing it.
So we're the only
Yes, sir.
ACL place
Repair.
that's doing it.
Yes, sir. We are the only, Mill Creek Community Hospital is the only hospital in Erie, Pennsylvania that's doing the BEAR.
Which really puts us on the cutting edge.
It does.